Hey, everybody. And happy Friday one last time. I think I cut my hair too short. Oh well, it'll grow out. Um, I'm getting ready to leave in about 30 minutes for San Antonio. Tim's going to be here. Um, but I just wanted to let y'all know how my MD Anderson appointment went yesterday with Dr. Yonku. It went absolutely fabulous. Um, he said that I am like the person that they have been like needing and looking for this new trial chemo, which is called, I think it's PLX 8394, something like that. It's a phase 1 trial chemo. Not real sure what that means, but um, and I basically asked him when he would want me to start it, and he said within like a week to 2 weeks. But we've got to take a trip to Houston first before we can start it, before I can start it, because he has like a whole battery of tests that he wants to run, EKGs, a bunch of other things like that. So we are going to be taking a Houston trip in the next 2 weeks at most. And then I would start it. And then it's basically 28-day cycles, and I'll do it for 28 days. And if there's 31 days in the month, I'll get a couple days break, and then 28 days, and then, so on and so forth and so forth. They have not used it on a tumor like this before, like mine, but in the cancers that they have used it on, he said that it has been extremely successful and has just shown great progress. So that is totally, totally awesome. It is 7 days a week, though, so it's literally 28 straight days. It's 5 pills in the morning, 5 pills at night. Ugh, big old horse pills, but that's fine. I mean, you got to do what you got to do. He said that it does have a few minor side effects, and he said those side effects tend to be, of course, nausea, vomiting. Some have had diarrhea, which I never had that with my last chemo. Not that part anyway. And then it can cause your liver enzymes to be real elevated. And so he said he is a little concerned with my, nausea and vomiting issues that I have, which I take Zofran and Compazine for that. And then also when I did chemo before, I did a patch, and I can't think of the name of it right now, but I wore a patch as well when I was on my chemo. And he said that we can also do that on top of the Compazine and the Zofran. And he said that the first 2 months, he's going to want to see me in Houston at least once a month. If I'm doing okay on it, once a month. If I'm having issues with it, he'll want to see me twice a month. And then after that, I only have to go to Houston once every 2 months. And of course, my neuro here will still scan me every 90 days. So, like, even if I start this, like, say, the mid-March or even the beginning of April, I still have my April 19th scan with my neuro-oncologist here. So I'll be doing that. There's no cost to me. He said unless like my insurance doesn't pay for, part of the MRIs, EKGs, things like that. So far I've been blessed, and my insurance has paid. I mean, it paid for, proton therapy radiation, which is like 28 grand a session, and I did 33 of them. So, and so far, and mind you, having MRIs every 60 and 90 days, I've had a lot. It'll be 3 years in May since I was diagnosed on my birthday in May, and it's covered all of those. It's covered every test, every hospital, my brain surgery, and so basically, so there's no cost to me. So that's really, really good, because a lot of these trial chemo drugs, there is a cost for. Like my dad is on Zytiga, which is a trial drug, which has been doing great for his prostate cancer. But that stuff's like $3,000 a month. But luckily they put him on a grant, and it covers like 10 months of it or something like that. And then he just reapplies for it. So there are things like that. He said that the social worker is going to reach out to me because there is a slight reimbursement that they help with as far as when we have to come to Houston for travel and lodging and things like that, food. That it's not a lot, but I mean, anything helps, even if they give us $30 back, $40 back, whatever, $50, $25, it's whatever. Let's see, what else? I have a whole list of questions that I wrote down, and I'm trying to think. Hang on, let me pause that. Let me go get them. Hang on. Okay, I had to get my questions. And then let's see. So that's the great thing about doing. As soon as he said I'll be doing it 7 days a week, I'm like, oh yes, that means I can do it home. Because if he would have said like 5 days on, or like my other chemo is like I don't know, say it was like, I don't remember what I did. I did like 7 days, or I don't remember. I did like 21 days on, so many off, something like that. But as soon as he said 7 days a week, I was like, awesome, because if he would have said, oh, you're gonna do like say 7 days on and 21 off, then there was a very good likelihood that they may want me to be in Houston for those 7 days. And then yeah, PLX 8394 is the study name or whatever. And then yeah, they've had a lot of success. I've already gone over the side effects. Oh, and then he said that right now, ever since this trial has started, he said so far they've got people that have been on this for a couple of years, and it's basically holding their cancer at bay. And so he said, as long as I can tolerate it, and or as long as I want to be on it, I can do that. If I like, so I could be on it for a year, 2 years, 4 years, just however long I can take it. I'm on the list to get a COVID shot because I have not gotten one yet, even though I've been on the waiting list since January. Me and my dad both, and we're both in that high-risk category. Him because of his age and cancer, me because of my cancer. And he said that, yes, that I can get a COVID shot, but he really prefers me to try to get one before chemo starts, only because if I have any side effects from the shot, they don't know whether it's side effects from the shot or whether it's side effects from chemo. But I can still get one while, he just said just get one when it comes up. But I may just kind of put that off. I don't know. But yeah, so that's pretty much it as far as now. And then also like I said, I did another phone interview with the National Cancer Institute. They called me this morning and we got some more, they sent me some more paperwork. I got that all e-signed and got that sent back to them. And they are now requesting a tissue sample from when my brain surgery was done from UT Southwestern in Dallas. And she said it'll take 2 or 3 weeks to get that sample and get it. They do like their own genetic testing on it, even though I've got the Tempest testing. But because I asked for my biopsy to be DNA tested just to make sure we knew exactly what we were dealing with. So, which that's awesome. And then she said after that, they will basically reach out to me and then I guess kind of get things set up to have me go to Washington. And the great thing about that is they pay for everything. Flights for me and Mom, lodging, food, everything. They pay 100% for all that. So that will be really, really good. And so now I am, like I said, I'm just waiting for the nurse and the social worker from MD Anderson to reach out to me and get my appointment, and the scheduler, the scheduling coordinator, to call me to get my appointment scheduled. And like I said, I asked him, when would I start this? And he said, like a week, 2 weeks. Like, he's like, I want you to like start it now, but I've got to do all the tests and everything first. So I'm just like so excited because like I said, I'm never, ever. Everybody's like, oh yeah, we've got this surgery, or we've got this new this, or this new that, or this new technology, or this new trial. Oh, but not you, because yours is in the brainstem. So, but it's so funny, like the people from the National Cancer Institute, it's like they are like basically jumping on me because, like I said, this has never been found in an adult before, ever in the history. And so everybody's wanting to be like a part of it. So I literally have neuro-oncologists that are now on board with the United States Army that are working with the National Cancer Institute. And then I've got another neuro-oncologist. Let's see, that is from Frederick National Laboratory for Cancer Research. That is has jumped on board. So it's like I basically have all these crazy smart people jumping in and be a part of this. So because like I said, this is all new to them. They've never seen this. So, and my goal has always been that, like how do I put this? Like I don't know. We don't know if anything can be done for me. but I want something to be done for people in the future. You know, and that's what I was telling the lady Kathleen that I was talking to. She's an oncology nurse with the National Cancer Institute this morning. You know, I said, anything that I can do to help. I don't want anybody else in this position where nobody knows. We don't know how to treat it. We don't know what to do. You know, it's crappy. It's a crappy situation to be in. And so anything that I can do to contribute while I'm still on this planet and after, that's exactly what I want to do. And that's why I've already signed my brain away, basically, to UT Southwestern, so that when something does happen to me, they can have it and they can research it and, you know, find out everything that they can find out. So anything to help somebody else down the road then my job is done. So, so I'm just really, 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 really excited, and I really, really, really hope once I start this chemo, I don't have any side effects from it, and I'm able to tolerate it, because, you know, I've heard that before. Oh, you'll have minor side effects. Wrong. So, but anyways, so I just wanted to tell you all that. But yeah, I gotta go get all my stuff out by the front door, because like I said, Tim should be here anytime to pick me up. So we're gonna go stop and grab some grub and then head to San Antonio. So I'm excited, but I hope you guys have a beautiful and blessed weekend. And like I said, I'll take videos and get everything uploaded and just kind of share my trip with y'all. And I love you guys as always. So bye, guys. I'll talk to you soon.